Retshil-An and Bagarino from BSL 2A. And now I am going to perform a bag technique. So moving on, a bag technique is a tool by which the nurse, during her visit, will enable her to perform a nursing procedure with ease and deftness to save time and effort with the end view of rendering effective nursing care to the client. So the public health bag, this one, is an essential and indispensable equipment of a public health nurse which she has to carry along during her home visits. So it contains basic medication and the articles which are there are basic principles of a public health bag or the bag technique. So first is performing the bag technique will minimize, if not prevent, the spread of any infection. Second, it saves time and effort in the performance of nursing procedures. Third, or the last, is the bag technique can be performed in variety of ways depending on the agency's policy, the home situation, or as long as the principles of avoiding transfers of infection is always observed. So there are the contents of the PHN bag or the public health bag. First is the plastic lining, the paper lining, the apron, the hand towel, the sterile glove, cotton balls, spring balance scale, kidney basin, the thermometer in case, there are kinds of medical surgical scissors. First is the bandage scissors, the curved medical scissor, the Mayo straight, and the California straight scissor. And also there are a umbilical cord clamp sterile or disposable. There are three types of syringes: 5cc, 1cc, and the 3cc. Also there are kinds of needles: 23, 22, 25, 19. And the sterile gauze pad, 2x2 and 4x4. The tongue depressor, the alcohol lamp, test tube and test tube holder, the hydrogen peroxide, and the 70% of alcohol or the isopropyl, the betadine solution, the ammonia, and tape measure. That's all the contents of the PHN bag. There are points to consider in performing the bag technique or the PHN bag technique. First, the bag should contain all the necessary articles, supplies, and equipment that will be used to answer the emergency needs. Second, the bag and its content should be cleaned very often, the supplies, and replaced, ready for use anytime. Third, the bag and its content should be or would be able protected from contact with any articles in the patient home. Fourth, consider the bag and its contents clean and sterile, while articles that belong to the patient as dirty and contaminated. Lastly, the arrangement of the contents of the bag should be the one most convenient to the user to facilitate efficiency and avoid the confusion. Upon arrival at the patient home, place the bag on the table, lined with a plastic lining and a paper. The clean side must be out and the folder part touching the table. This is the plastic lining. And this is the paper lining. After placing the two, put the bag on the top of the paper lining. So this step is to protect the bag from getting contaminated. Second, take out the apron from the bag and put it with the right side. This is to protect the nurse uniform. So after we put the apron, second, put out all the necessary articles or equipment needed for the specific care. So this is to have them readily and accessible for the specific care. So after putting out all the necessary equipment that we will be using, we will close the bag and put it in a corner or one corner of a working place or in our working area. This is to prevent the contamination. So next, we will be proceeding on performing the necessary nursing care treatment. So now, the nursing care that I will be going to treat is the wounded care. So here I am going to use the medical scissors. I put it in the kidney basin, the adhesive plaster, and the 2x2 and 4x4 gas pad. And lastly, we will be using these sterile gloves and the cotton balls if needed, the isopropyl alcohol, and the hydrogen peroxide, and lastly, the betadine solution. After giving the treatment to the patient, I will be cleaning all things that were used and perform hand washing after this. This is to protect the caregiver and prevent the infection. Imagine that I clean and I already done hand washing my hand. So next, moving on, I will be open my bag or my PHN bag and return all the things that I used in treating. Next, I will be removing the apron and folding it away from the person or a soil. This is to remove apron and folding it away from the person that soiled side and clean side out place in the bag. After I put the apron in the bag, I will be folding the lining, the paper and the plastic lining. Things I use, I will take the record and have a talk with the mother or the guardian of the patient I treat. And lastly, I'll make an appointment for the next or either home or clinic visit and taking note of the dates and the time. This is for the follow-up care. That's all for my PHN bag technique. Thank you.